Blackheads are one of the most common skin concerns in dermatology, and they're also one of the most preventable, if you understand what they are and you follow a routine that keeps pores clear without irritating your skin. This voiceover is general educational information and not a personal medical diagnosis. If you have severe acne, painful deep bumps, significant scarring, a widespread rash, or if you are pregnant, breastfeeding, or using prescription medications, It's best to speak with a qualified clinician for individualized advice. For most people, though, blackhead prevention comes down to a few consistent habits that are safe, realistic, and effective over time. Let's begin with what a blackhead actually is, because prevention becomes much easier once you stop thinking of blackheads as dirt. A blackhead is an open cum. Inside each pore is a hair follicle and a sebaceous gland. The sebaceous gland makes sebum, which is your skin's natural oil. Your skin also sheds dead cells continuously. Under healthy conditions, sebum and dead cells move out of the follicle normally, and the pore stays relatively clear. A blackhead forms when the follicle becomes plugged by a mix of sebum and dead cells that clump together. The top of that plug remains open to the air, and the material darkens as it oxidizes. That dark color is not dirt that you can scrub away. It's a chemical process and a visual effect at the surface of the pore. This is why harsh scrubbing and overwashing often make blackheads worse instead of better. The goal is not to scrape out the black color. The goal is to prevent the plug from forming and to help the follicle lining shed smoothly so debris doesn't get trapped in the first place. Blackheads commonly appear on the nose, inner cheeks, forehead, and chin because these areas have a higher density of oil glands. Genetics strongly influence how oily your skin is and how easily pores clog. Hormones also play a major role. During adolescence, sebum production increases, which is why teens often see more blackheads. Adults can experience blackheads too, especially around hormonal shifts such as menstrual cycles, stress, sleep disruption, and certain endocrine conditions. Environment and habits matter as well. Heat, humidity, sweat, friction, occlusion from masks or helmets, and heavy products can all encourage pore congestion. Even small daily patterns like touching your face, resting your chin on your hand, or letting hair products sit on your forehead can lead to more clogged pores in specific zones. A big reason blackheads keep returning is that many routines focus only on cleansing and oil control, but not on the biology of how comedones form. Cleansing is important, but cleansing alone usually does not change the behavior of the follicle lining. Preventing blackheads reliably typically requires at least one proven pore-clearing ingredient used consistently over time. The two most evidence-based categories are salicylic acid, also known as beta-hydroxy acid or BHA, and topical retinoids, including over-the-counter retinol and prescription retinoids guided by a clinician. Salicylic acid is oil-soluble, which helps it travel into oily follicles and loosen the mixture of sebum and dead cells. Retinoids help normalize cell turnover inside the follicle so dead cells are less likely to clump together and form plugs. These ingredients work best when used gently and consistently, not when used aggressively for a few days and then abandoned. Before you introduce any active ingredient, you want a stable foundation, gentle cleansing, reliable moisturizing, and daily sun protection. People often underestimate how much the skin barrier affects blackheads. When the barrier is irritated, when your face feels tight, stings, burns, or flakes, pores become more reactive. The pore opening can swell slightly, making it harder for oil and debris to exit. Irritation also increases the temptation to overcorrect with harsh products, creating a cycle that keeps blackheads coming back. A calm, supported barrier makes everything easier. You tolerate treatments better, you stick to your routine, and your follicles shed more smoothly. Let's talk about cleansing the right way. The ideal cleanser for blackhead-prone skin is gentle but effective at removing sunscreen, makeup, sweat, and excess oil. Squeaky clean is not the goal. That squeaky feeling often means the cleanser removed too much of the skin's natural lipids, which can lead to dryness and rebound oiliness. For most people, cleansing twice daily is a good baseline, once in the morning and once at night. If your skin is very dry or easily irritated, you may do better with a morning rinse or a very gentle cleanse, and then a full cleanse at night. If you exercise and sweat heavily, cleansing soon after your workout helps prevent sweat and oil from mixing with debris on the skin. Technique matters. Use lukewarm water, not hot water. Hot water can increase irritation and redness. Apply the cleanser with your fingertips and massage gently for about 20 seconds, focusing on blackhead-prone areas like the nose, inner cheeks, chin, and forehead. Rinse thoroughly and pat your face dry with a clean towel. Avoid aggressive rubbing because friction can create microirritation that makes pores more reactive. Cleansing tools and rough scrubs are not required, and for many people they do more harm than good. Night cleansing is especially important because you need to remove sunscreen and any makeup or environmental residue. If you use water-resistant sunscreen or long-wear makeup, consider a gentle double cleanse. This can mean first using a mild cleansing balm, cleansing oil, or micellar type remover to dissolve sunscreen and makeup, followed by your regular cleanser to remove residue. The purpose is thorough removal without stripping. If double cleansing makes you dry, adjust by choosing gentler formulas or doing it only on heavy product days. Now, moisturization. Many people prone to blackheads avoid moisturizer because they fear it will clog pores, but skipping moisturizer can backfire. Dehydrated skin often becomes rougher and more reactive. Flakes can mix with oil and contribute to clogging. A compromised barrier can trigger stinging, redness, and rebound oiliness. The goal is to choose a moisturizer with a texture that feels comfortable on your skin and supports the barrier without feeling greasy. Many people do well with lightweight lotions or gel creams, especially for oily or combination skin. Look for hydration-supporting ingredients such as glycerin and barrier-supporting ingredients such as ceramides. The specific product matters less than consistent use and how your skin responds. If a moisturizer feels heavy or seems to worsen congestion, try a lighter texture rather than skipping moisturizer entirely. Moisturizing is one of the best ways to keep your routine tolerable long-term. Daily sun protection is another key step. Sun exposure contributes to long-term skin thickening and uneven texture, which can make pores appear more obvious. It can also worsen post-acne discoloration. If you use acids or retinoids, sun protection becomes even more important because these ingredients can increase sun sensitivity. Choose a broad-spectrum sunscreen you can wear every day. If you are prone to clogged pores, you may prefer lightweight fluid, gel, or serum-style sunscreens labeled non-comedogenic. If one sunscreen feels heavy or seems to worsen blackheads, switch textures instead of abandoning sunscreen. Consistent sun protection supports smoother-looking skin over time and helps you use your preventive products more safely. Once your foundation is in place, cleanse, moisturize, protect, you can introduce a targeted active ingredient. Salicylic acid is often the most direct and effective option for blackheads because it can penetrate oily follicles. You can find it in cleansers and leave-on products such as toners, serums, and pads. Leave-on products often work better for prevention because they stay on the skin longer, but a salicylic acid cleanser can be a gentler starting point for very sensitive skin. If you start with a leave-on salicylic acid product, begin slowly. Use it 2 or 3 nights per week at first. Apply a thin layer to blackhead-prone zones after cleansing and drying your skin, then moisturize. After a couple of weeks, if your skin is comfortable, meaning only mild, temporary dryness, you can increase frequency. If you experience burning, persistent redness, or peeling that lasts, reduce frequency and focus on barrier support until your skin calms down. Retinoids are a powerful long-term prevention option. They help normalize how the follicle lining sheds, reducing the formation of comedones. Retinoids also improve overall texture over time. The most important rule with retinoids is to start low and slow. Use only a pea-sized amount for your entire face, not a large blob. Apply to fully dry skin to reduce irritation. Start 2 nights per week for about 2 weeks, then every other night for several weeks, then consider nightly use if your skin remains calm. Moisturizer is essential with retinoids. Many people tolerate retinoids much better using the moisturizer sandwich method: apply moisturizer, then a small amount of retinoid, then moisturizer again. This helps reduce dryness and irritation while still giving you long-term benefit. Some people eventually use both salicylic acid and a retinoid, but it should be done carefully. Starting both daily is a common cause of irritation and setbacks. A safer approach is to alternate nights, especially early on. For example, salicylic acid on one night, retinoid on another night, and then 1 or 2 rest nights focused on gentle moisturizing. Over time, you can adjust frequency based on your skin's tolerance. Your skin's comfort is not a side issue, it's central to success, because blackhead prevention requires consistency for weeks and months. It's also important to set realistic expectations so you don't get discouraged. Blackheads don't form overnight, and they don't disappear overnight. With salicylic acid, some people notice smoother texture within a couple of weeks, but visible reduction in blackheads often takes 4 to 8 weeks of consistent use. With retinoids, meaningful improvement often becomes clearer after 8 to 12 weeks, with continued improvement over several months. During early retinoid use, some people notice a temporary increase in small bumps as microclogs come to the surface faster. This can feel alarming, but it may be temporary. The best approach is to avoid panic changes. If your skin is not severely irritated, stay consistent and moisturize. If your skin is irritated, reduce frequency and rebuild the barrier, then restart slowly. The goal is steady progress, not sudden dramatic changes. A major factor that blocks progress is irritation from overexfoliation. Many people try to scrub out blackheads. Physical scrubs and rough cleansing brushes can cause microirritation, especially around the nose and inner cheeks. Irritation can swell the pore opening and trap material, making blackheads more stubborn. If you want exfoliation, chemical exfoliation is usually safer and more targeted. For blackheads, salicylic acid is generally more relevant than surface-focused exfoliants. Alpha-hydroxy acids like glycolic acid and lactic acid can improve surface brightness and smoothness, but they do not penetrate oil as well as salicylic acid. If you choose to use an AHA, keep it occasional and avoid stacking it with a retinoid on the same night early on. Too many actives at once is one of the fastest ways to damage the barrier and prolong blackheads. Let's talk about quick fixes and why they often disappoint. Pore strips can pull out some surface material temporarily, but they do not correct the underlying process that forms blackheads. They can also irritate the pore opening and lead to more congestion later. Clay masks can temporarily reduce oil and make pores look smaller for a short time, which some people enjoy, but they should be used occasionally, not as the core of prevention. If you like clay masks, treat them as a once-weekly supportive step, followed by moisturizer. The core remains consistent cleansing, a proven pore-clearing active, moisturization, and daily sunscreen. Picking and squeezing is another major reason blackheads persist and sometimes turn into inflamed acne. When you squeeze a pore, you can push material deeper or rupture the follicle wall, triggering inflammation. That inflammation can lead to redness, swelling, prolonged healing, and sometimes scarring or dark marks, especially in deeper skin tones. Even if you remove some material, the trauma can cause the pore to swell and clog again. If you feel tempted to squeeze, it usually means you want faster results than your routine is giving you. The safer strategy is to stay consistent with your prevention routine for several weeks. If you have stubborn blackheads that do not respond despite consistent care, professional extraction performed by a trained clinician is safer than home squeezing. Another concept that reduces frustration is understanding the difference between blackheads and sebaceous filaments. Many people look at the nose and see tiny gray or dark dots and assume they are blackheads. Often, those dots are sebaceous filaments, which are normal structures inside pores that help move oil to the surface. They can be more noticeable in oily skin and may refill quickly after you clear them because they are part of normal anatomy. A consistent routine can make them less noticeable by keeping pores cleaner, but they may not disappear completely. Recognizing this helps you avoid overtreating your skin and damaging your barrier in pursuit of an unrealistic goal. Product choices beyond actives matter a lot. Sunscreen, makeup, moisturizers, and hair products can all contribute to congestion depending on texture and residue. Non-comedogenic labeling can be helpful, but it's not perfect because individual skin responds differently. If you notice blackheads worsen after introducing a new sunscreen, primer, foundation, or moisturizer, stop that product for 2 weeks and observe. Change one thing at a time so you can identify the cause. At night, remove products thoroughly. Makeup residue and sunscreen films can accumulate around the nose creases, chin, and jawline. Clean your makeup brushes and sponges regularly because they can store oils and residue that transfer back onto the skin. Hair products are a common hidden trigger for forehead and temple blackheads. Pomades, heavy oils, leave-in conditioners, and styling creams can migrate to the forehead and clog pores along the hairline. If you get blackheads in those areas, keep hair products away from the scalp edges, avoid letting oily hair rest on the forehead, and cleanse the hairline carefully at night. Washing pillowcases regularly can help as well, especially if you use styling products that transfer. Friction and occlusion are major triggers for blackheads around the mouth and chin. Masks, helmets, chin straps, tight collars, and frequent face touching create warmth and humidity that trap oil and debris. If you wear masks for long periods, cleanse after extended wear when possible, use a light moisturizer to reduce friction, and avoid heavy occlusive products under the mask. Replace disposable masks as recommended and wash reusable masks frequently with a gentle detergent. This is not about perfection, it's about reducing a predictable environment that encourages comedones. If you shave, shaving irritation can also contribute to clogged follicles and bumps along the beard area. Use a gentle shaving product, shave with minimal pressure, and moisturize afterward. Avoid harsh alcohol-based aftershaves that sting, because irritation can worsen follicular plugging. If shaving bumps are a recurring issue, you may need to adjust technique, frequency, or consider professional guidance. Lifestyle factors don't create blackheads out of nowhere, but they can influence sebum production, inflammation, and your ability to tolerate skin care. Sleep matters because poor sleep can increase stress hormones that may affect oil production. Stress can have similar effects. Exercise is excellent for overall health, but sweat left on the skin can mix with oil and contribute to congestion, so rinse and cleanse after workouts. Hydration supports skin comfort and barrier resilience. It won't flush pores, but it can help you tolerate actives better, which improves consistency and results. Diet is often discussed in acne prevention. The most balanced approach is individualized and realistic. Some people notice acne and congestion worsen with high glycemic patterns, frequent sugary snacks, and refined carbohydrates, possibly due to effects on insulin pathways and inflammation. Some individuals notice flares with high dairy intake. These patterns are not universal, and extreme restriction is not necessary for most people. A balanced diet emphasizing fiber, vegetables, fruits, lean proteins, and healthy fats supports overall skin resilience. If you suspect a dietary trigger, test one change at a time for several weeks and observe. The goal is sustainable habits, not a strict elimination approach unless clearly needed. Now let's put all of this into a simple, workable daily plan. In the morning, cleanse gently or rinse if your skin is dry, then apply a light moisturizer if needed, then sunscreen. In the evening, cleanse thoroughly to remove sunscreen and residue, then apply your chosen active on the appropriate nights, then moisturize. If you are new to actives, start with either salicylic acid or a retinoid, not both at the same time. Use it a few nights per week and build up gradually. If irritation appears, reduce frequency and focus on moisturizing until your skin calms.